Today, as the True Wealth Health and Nutrition series is on its fourth episode of Personalities and Peculiarities Impact on Diabetes with Dr. Anil Buraskar, we see a different shade of his own towering personality, Dr. Anil Buraskar himself. We can see how emotional and compassionate he is about his own patients and how his patients' personalities impact him too. This patient today is merely a homemaker, or should I say, a 24 by 7 unpaid overtime worker. She who is pivotal in taking care of the entire household and is intelligent enough to make the right choices for her family and manage a good diet with simple lifestyle. However, while relentlessly taking care of her family, like most women do, she neglects her own self and her health. When such a lady who is elegant and bright, even in her 70s, arrives to Dr. Anil Buraskar's clinic, he expresses how he feels the respect and care towards such able but neglected mothers. I'm sure most of us watching this will be able to identify this personality with our own mothers. In this episode, Dr. Anil Buraskar, who is a renowned diabetologist from Mumbai, practicing at the Raheja Hospital, the Asian Heart Institute, and the Asian Cancer Institute, respectfully and affectionately showcases this personality. Her name is Mrs. Iravati Date. And he shows that how her personality type and peculiar behavioral characteristics can actually cause diabetes and its complications and how it affects its management. True Wealth Integrative Healthcare is privileged to facilitate this series of serious humor for understanding diabetes and managing well with it with Dr. Anil Buraskar. This series, we believe, will benefit not only the patients and the doctors in managing the diabetes, but also in strengthening their interpersonal understanding. Over to Dr. Anil Buraskar.
Good morning, friends. Now, in the fourth episode of Personalities, Peculiarities, and its effect on diabetes, today I am going to describe a prototype of a classical Indian housewife. India has got multiple families, and that is the brickbone structure of the country which has kept us intact, which has not allowed us to get destroyed like so many Western countries because of our family structure is very strong. And the real backbone of this family structure is the housewife. A housewife is a specialty which unfortunately is taken for granted. It does not get its due importance and is always looked at somebody who is taken for granted. I feel a housewife plays a great role in the life of a lot of people, children, husband, relatives, in general in society. They are the integral part of a sound society. We have a prototype of such person whose life is full of sacrifices, whose life is full of understanding, compassion, help to the rest of the family members. In the bargain, she had a very little time to pay attention to her own health. However, her level of intelligence and level of knowledge was so good that she was able to manage her diabetes for almost 20 years without really doing any hi-fi test or getting any fancy drugs, only observing certain restriction of lifestyle, which she understood, which she realized that that is the only way to take care of her health, because in terms of priority of expenditure in the family, she has to preserve the money and the efforts for her husband's health, for her son's health, for her daughter's health, for her in-laws' health, and therefore she has the lowest priority in the family structure, and therefore she never complained. Her name is Mrs. Iravati Date, a very pious, a gentle lady who come always. She had seen me at least 20-25 years, not her as a patient, but she used to bring her husband, she would bring her sister-in-law, she would bring her friends, father-in-law. She never complained about anything about herself. Every time she would greet me smilingly, and she would encourage me to come to a good diagnosis about the relatives that she would bring. Whatever I could tell them, she had a great deal of perception what I was talking, and she will do the job of a counselor and explain everything to her husband or the children what I was trying to talk in the medical lingo. Iravati Date herself, she is in now her 74 age. She is graduated from Pune SP College, bachelor's in arts. After God, she got married fairly young. I think she got married at the age of 20. And she comes from a background of a school teacher with 3 siblings, and got married in a family, was a retired army officer. He was actually an army officer. The son works for a bank, means her husband works for a bank in a big position. But growing children, both the children are going in professional colleges. One is becoming a doctor, other is becoming an engineer, and the fees and their general demands is a reasonable drain to the family. Because husband works in bank, but he is, I think, a very straightforward, good, decent chap. So he has a limited resources and limited money, but they are very upright and a very nice, decent family. But husband was a diabetic for a long time, but again well managed. There's no problem with him. And part of the management was in the hands of Mrs. Iravati. She took the complete charge of his diet, monitoring, complete charge of his well-being, and gave him, and whatever new would come in the reading, she would read it. She'll first discuss that with me, की डॉक्टर आज हे मी ऐकलंय, वाचनात आलंय, आज महाराष्ट्र टाइम्समध्ये असा, ह्यात काय वाटतं तुमचं, काय मत आहे? And then she would say that, well, I can talk about it to my husband. Such a wise and a polished lady, you know. It was always a pleasure when she would come to the clinic, and she would be well read about the recent development in politics and the art. She was also, like me, fond of Bhimsen Joshi, and she would let me know that this particular clip that I've heard, have you heard this? Her meeting with the rest of the family was an interaction of a great deal of cultural exchange. And I had an immense regard and respect for this lady. And for almost 20 years she would accompany me, accompany the relatives without even once. I mean, I would have never said that you are not consulting me, therefore I will not treat you. She never complained of anything in 20 years. Even the minor illness, like some women like to point out, at the time of menopause they have backaches and osteoporosis, bone aches. Nothing she would complain. Very smiling, very pleasant lady. Always reminding me of my mom. I'm my mom's boy. So she kept on reminding me of my mother and her virtues and her values. I'm sure she has been from the childhood was trained by a very good idealistic teacher who gave her values, and it was always an exchange of that. Now the peculiarity of such people, they put a great deal of sacrifice. At least with Iravati Bai, it was obvious that she was doing everything for others, for her son, for her daughter, for her husband, for her sister-in-law, for her father-in-law, but did not spend any money on herself. So much so that I am observant enough to realize that she would come to my clinic almost 20 times she must have come. In 20 times that she came, she must have barely changed her saris 6 to 7 times. It clearly shows that her collection of saris was not too much, just bare minimum for personal expenditure. She was always very neat and tidy. She was a fairly good looking lady. But her specs were old, they're not new fashion. She didn't spend much money on her makeup or hairdo. She had all grey hair and never had any makeup. She didn't need a beautiful complexion, typical Chitpan Brahman's complexion, and very sharp features and smiling face. Most important, divine smiling face. Every time she would walk in my clinic, I would get a feeling that I am blessed. But the interesting part is that one day we got chatting about her husband's surgery, and the surgery was planned for his cataract, and we found that his blood sugars were not up to the mark. All this time they were in good shape, but suddenly the sugars have shot up. So I was trying to find out why, what has gone wrong, is it stress or anything else. So she pointed out that maybe we have slightly changed our oil in our diet. And बरं का डॉक्टर, मला जरा डाऊट होता म्हणून मी माझी पण ब्लड शुगर करून घेतली. गेल्या 20 वर्षात कधी मी केले नाही. हा म्हटलं काय, ती पण जास्त आहे हो. म्हटलं यू आर नॉट अ डायबेटिक. म्हटलं हो, इवन आय फेल्ट दॅट आय एम नॉट अ डायबेटिक. बट दिस आय जस्ट गॉट इट डन बिकॉज विलासरावांचं आम्हाला करावं होतं सर्जरी. तर विलासरावांचं करायला गेले तर म्हटलं माझं एक करा बघूया. तर माझी फास्टिंग शुगर 200 आणि पोस्टलन्स 240. आणि दिस इज आफ्टर आय ऑब्झर्व रिझनेबल डायट. आय डोंट टेक एनिथिंग फ्राईड. सो दॅट मीन्स आय हॅव अ डायबेटिस. म्हटलं HbA1c केलं का? नाही, ते मी केलं नाही, कारण ते टेस्टची किंमत 500 रुपये. म्हटलं जाऊ द्या, काय 500 रुपये फरक पडतो, आपण करू, माझ्याकडे मी फुकट करतो, डोंट वरी. पण मला HbA1c करायला पाहिजे. HbA1c we did it. Her HbA1c was 8.5. That means she has been a diabetic for more than a year. Then I had to explain to her that look here, you will need some medication. She said, I've been trying to avoid medication, to be very frank. And whether I really need, I have no symptom. I said, no, but this is a time that 200 sugar is too high, we have to treat it. So I gave her a simplest medicine, not costing too much. I tell her, you take it once a morning before breakfast, and then you will have to adhere to timing of lunch. She says, I try my best, but doctor, you try to understand, we are a family of 4 people. And, the children sometimes they eat at home, sometimes they don't come for dinner. So I'll end up having a lot of leftover. And somehow I feel the leftover should not be dumped. In our house, we never dumped any food. But I agree with you, but while eating leftover, there is always a tendency that you may overeat because you have to finish it. I see that point, but I make it a point that I eat leftovers, but next day I make some lovely recipes out of that. I decorated it nicely. म्हणजे आदल्या रात्रीचा शिळा भात दुसऱ्या दिवशी फोडणीचा भात म्हणून चांगला लागतो. बट त्याच्यात तुमचं तेल जातं जास्त. That is true. She had a peculiar methodology of conserving wastage of food. As a result of which, without she letting me know, I realized that this lady is only eating शिळं अन्न. शिळ पाक ज्याला म्हणतो ना. I think it's amazing that our women do it reflexly because they want to see that the fresh food is given to husband and the children. Hot chapatis and hot bhaji. She would stand in the kitchen. She had no cook at home. She would give him विलासरावांना गरम गरम फुलके आवडतात. म्हटलं मग ते येतात तर मी त्यांना पहिले फुलके करून देते आणि नंतर मी जेवते. म्हटलं कमाल आहे. मग तेव्हा लक्षात राहत नाही, कधी कधी 2च खातात, मग 4-5 उरतात, तर मग मी 4-5 खाते. Oh, I said that is a mistake because your tendency is to finish the leftover. That you can avoid. Okay, I can keep it in deep freezer and warm it next day. But that is one thing. Second thing, what about other types of food? सणासुदीला I'm very careful मला म्हणाले. I'm normally don't, even सणाच्या दिवशी सुद्धा मी फक्त चवीला खाते. I know that it is not a good stuff. But I do prepare. For all festivals, we prepare something nice, sweet. Children eat it. And there is a point in our house that on certain days, everybody has to eat dinner with switching off the mobiles. This discipline I have started. आमच्याकडे जेवताना कोणी मोबाईल वापरत नाही आणि at least one meal all of us take together. On that day I have prepared special dishes. त्यांना जे आवडत, and I quite agree, when they have prepared special dishes, they are far from your dietary principles. I try my best, but many times the taste of the children is spoiled so much that you have to somehow avoid sticking only to nutritional program. म्हटलं इरावतीबाई, हे सगळं तुम्ही व्यवस्थित करता. I think your family's health is excellent, but now is the time that you have to pay attention to your own health. She says, yeah, actually विलासरावांना काय echo आणि हे सगळं सांगितलेलं. Some investigations have been advised for his prostate. So we will attend to that, and then I will get my investigation done for whatever you tell me, for heart and for kidney, to see whether there are any complications to diabetes. I said, no, you shall do it on priority. Then she says, काय की सध्याच माझ्या मुलाचं त्यांनी जॉब सोडलेला आहे आणि ही इज डुईंग सम हायर स्टडीज इन MBA. त्याची ट्युशन फीज टू मच. म्हणजे वी आर ऑल्सो टेकन लोन अँड पेईंग EMI. But that is okay. What is the priority? Hey, I am important. No, but I would like to wait for about 3-4 months. I said, बघा असं करताना कधी कधी कॉम्प्लिकेशन वाढायला नको, मग त्याच्यावरती होणारा खर्च कदाचित जास्त पडेल. नाही, सध्या विलासरावांचं पण मी असं काही टेस्ट वगैरे करते आणि मग येऊन भेटते. एवढी सोशिक, सच अ काइंड हार्टेड वुमन. I said, look here, Iravati madam, by the grace of God, I am quite powerful in my hospital. I would like to do all these tests in my hospital, and I will see that nobody will charge you. No, doctor. That is one thing I don't like. I would not like that. I say, look, when you are in a position and you feel comfortable, then you can pay the hospital. I can tell my hospital, if whatever tests are done should be done completely free of charge, and you don't worry. You don't have to worry about payment in my hospital. She started crying, Said, doctor, एवढा प्रेमाने आणि असं मला तुम्ही सांगताय, पण हे खरंच करायला पाहिजे का अर्जंटली? माझं ऐका तुम्ही, बघा आपण उगाच काहीतरी नंतर व्हायला नको. यू शुड बी फिलिंग फाईन अँड एव्हरीथिंग विल बी ॲब्सोल्युटली ऑल राईट. इट्स अ मायनर थिंग. इट्स नॉट अ बिग एक्सपेंडिचर. आय एम गोइंग टू डू इट. So she agreed. I did some tests, and luckily all her tests were normal, and her ECG, echo, renal functions, eyes, everything was perfect. She had mild diabetes, and we started that. And the hospital fellows, of course, were told by me that, look here, whatever the bill is there, you put it on my account. Hospital people also realized that this is a very decent lady. Devina was such a very dignified teacher-like personality. So when the hospital people did not give her a bill, a corporate hospital. Now this lady had that sense of obligation. 3 months later, she comes with a normal sugar, normal HbA1c. She had shed about couple of kilos of weight, and she was looking a lot active. She was active, but she looked a lot fresher. And in an envelope, she brought me 10,000 rupees. And she just kept that envelope on my table. I said, okay, what is this? She said, no, doctor, 3 months back you paid so much for all my tests and everything. I said, but this is out of proportion. I said, we have not charged you this much at all. This is not the expenditure. No, Amara, I understand this is a corporate hospital and the type of service I got. I mean, this is nothing. I said, no, you please take this envelope back. It's all taken care, because then I gave a lot of bullshit saying that we have some trust and we have some funds in deserving people and I have the powers to do it, so I did not have to pay for it, so you don't worry about it and all that. She did not believe a word in what I said. Then she looked at me and very lovingly she kept her hand on my head. She said, Dr. Sahib, तुमच्या भावना मला समजतात, पण मला एवढं तुम्ही बंधू पण समजू नका की तुम्ही काय सांगताय जेव्हा तुम्ही विश्वास तुम्ही हे पैसे ठेवा. म्हटलं नाही, इन प्रिन्सिपल आय वुड नॉट लाईक टू, बघा आम्ही काय एकही टेस्टमध्ये काही निघालेलं नाही आणि या टेस्टसाठी आय टेल यू फ्रँकली आवर हॉस्पिटल हॅज नॉट स्पेंड एनी मनी. You understand? These are all diagnostic tests which are very simple. So let me, I'm not saying that I will hold it as an obligation or nothing. मला स्वतःला बरं वाटतं, I've done it. So reluctantly she took that 10,000 rupees. Next day she calls me up and then she tells me, Dr. Boraskar, तुम्हाला पु ल देशपांडेचा खूप शौक आहे ना. म्हटलं हो. एवढंच मला फक्त विचारलं. अँड नेक्स्ट डे इव्हनिंग पुलंची लिहिलेली ओळनोळ 12-13 पुस्तकांचा एक संग्रह येरावतीबाई घेऊन माझ्या दवाखान्यात राहिल्या. म्हटलं हे काय, हे असं नाही तर असं काहीतरी. म्हटलं हे माझ्याकडे सगळी पुस्तकं आहेत आणि मी अशा वयात ही पुस्तकं वाचली की व्यक्ती आणि वल्लीचं पुस्तक मी एकाच्या ऐवजी 2 कॉपीज घेतल्या. माझ्या वडिलांनी म्हटलं हे का केलं. म्हटलं एक समजा लोक वाचायला घेऊन जातात, आणत नाहीत, म्हणून आपल्याकडे असं प्रत्येक पुलंची पुस्तकाच्या 2-2 प्रती आहेत माझ्याकडे. ऑफकोर्स ते आता जर्जन झाल्यात. त्याच्याकडे काय ते नवीन एडिशन नवीन आलं होतं लॉट, त्यातनं ते मला आणून दिली. त्यातलं एक पुस्तक मी आज दाखवतो तुम्हाला इकडे. भयंकर चांगलं लिहिलेलं आहे पुस्तक प्रभावकरांनी. हे प्रभावकरांचं पुस्तक आहे आणि अप्रतिम पुलंचं सगळं आनंद क्षणासाठी त्यांची एक एक असं हे अप्रतिम पुस्तक आहे. त्याच्यात हे पुस्तक मी माझ्या दवाखान्यात ठेवलेलं आहे आणि कुठल्याही क्षणी जरा माझी बॅटरी कमी झाली की मी यातली 2 पानं वाचतो. आता गंमत अशी झाली की इरावतीबाईंचं डोळ्याचं ऑपरेशन करायचं ठरलं. तर मी सांगितलं तुम्हाला चांगला इम्प्लांट लावू आपण, काळजी करू नका. डॉक्टर सगळं झालं ठीक आहे, आय वुड लाईक टू गेट इट डन इन सम चॅरिटेबल प्लेस. म्हटलं ऑफकोर्स आपण चॅरिटेबल ठिकाणी जाऊ. मी तिथे सांगितलं कुठे करायचं. मी म्हटलं माझं जे कॉर्पोरेट हॉस्पिटल आहे जिथे तुमच्या टेस्ट केल्या तिथे आपण मी तुम्हाला सांगितलं चॅरिटेबल. म्हटलं येस, वी ऑल्सो डू चॅरिटेबल सर्जरीज. मी माझ्या ऑप्थॅल्मिक सर्जन मैत्रिणीनं सांगितलं की या बाईचं ऑपरेशन आपल्याला प्रो बोनो करायचं आहे, इम्प्लांटचे फक्त पैसे ते देईल, कारण ते काय पैसे 7-8 हजार रुपये असतात ते चांगलं इम्पॉर्टंट इम्प्लांट. तेवढाच फक्त खर्च आपण त्याकडनं घ्यायचा. ऑपरेटिव्ह चार्जेस राईट ऑफ, थिएटर चार्जेस राईट ऑफ, हॉस्पिटलायझेशन चार्जेस 1 तासात काय फरक पडत नाही. आणि असं ऑपरेशन करून आम्ही काहीतरी तिला एका डोळ्याचे 5,500-6 हजार रुपये बिल दिलं. ती बिचारी पट्टा घेऊन इरावतीबाई मला सांगतायत, काय माझी मस्करी करता काय? म्हटलं देवा शपथ मला एवढाच खर्च आला. हे काय चॅरिटेबल हॉस्पिटल आहे? शेजारच्या खोलीच्या पेशंटला 1.25 लाख रुपये बिल त्यांनी मला सांगितलं आलेलं आहे. म्हटलं त्याचे प्रॉब्लेम्स कॉम्प्लिकेशन वेगळे होते. तुम्हाला अनकॉम्प्लिकेटेड केस, वेल कंट्रोल डायबेटिक प्रश्नच नाही. ठीक आहे. आता म्हटलं एक काम करा फक्त, की आता कृपया मला कुठलीही गिफ्ट देऊ नका. माझ्या घरी जागा नाही म्हटलं पुस्तकं ठेवायला, आणि माझ्यासाठी कृपया काही आणू नका. फक्त आशीर्वाद द्या. तो तर माझा असतो, जो तुम्हाला आमच्या पूर्ण फॅमिलीला तुम्ही बरं केलेलं आहे. त्याच्यानंतर इरावतीबाईंना माइल्ड सांध्याचा विकार झाला. होणार 76. मागच्या महिन्यात त्या आल्या. शी केम, शी लिम्पिंग. म्हटलं का, वाय यू लिम्पिंग सो मच? दिस नी जॉईंट इज बॉदरिंग मी क्वाईट अ लॉट. म्हटलं मग काय केलं? आपले मित्र आहे तिकडे, त्यांना जाऊन भेटा. माझे 4 ऑर्थोपेडिक सर्जन दोस्त आहेत. सगळ्यांचा सल्ला एकच. म्हटलं काय, नी जॉईंट बदला. म्हटलं नाही, आता नाव थिंग्स आर चेंजिंग. पीपल आर नॉट going for replacement. Tomorrow you may probably benefit only from physiotherapy and certain minor procedures. So why not take benefit rather than limping and having restricted mobility? That is also true. Vilasranapan, he has got a problem now. He is also using a walker, and I think we have become old now, doctor. But 76 is not an old age. But we are on the 2nd floor, climbing staircase and climbing down. No, there's no lift. So my activity outside has also gone down. I said, we'll try to restore it to normal. You listen to me. So physiotherapy to shuru kara. So I sent her to a physiotherapist. As the luck would have it, she went to a physiotherapist who was recently graduated, with little accent, and tried to talk to her in some complicated lingo and trying to sell her some funny gadgetry exercises, which is a new corporate physiotherapy lab, and trying to give her certain investigations as well as certain therapies which would generate a lot of money for the hospital. The lady is very smart to realize what she was up to. त्याच्यानंतर मला म्हणाले, शी केम बॅक टू मी, मुलगी छान आहे होती, लग्नाची आहे का? म्हटलं नाही, लग्नाच्या अगोदरची स्टेप आहे. म्हटलं नाही, वाटलंच मला जरा, पण मला कोणी दुसऱ्या वयस्क व्यक्तीकडे पाठवा तुमच्यासारख्या. म्हटलं माझ्यासारखे माणसं फिजिओथेरपिस्ट होत नाही म्हटलं. तर but I genuinely called up the hospital saying some senior person should give her a counseling. She was quite happy with the person that I asked. It was about seasoned physiotherapist. She took physiotherapy very seriously, believe me. I mean, nobody would do the exercises what she was told, and after 2 months, I think month of August or something, just rains were torrential, and Hindu colony gets flooded. In that flooded water, when they're coming to my clinic also, there's a water lock. She walked in my clinic like a normal person, without any problems. But hey, guy, what the next physiotherapist gave me such beautiful exercise. But from the hospital, I came to know that you attended his sessions only 6 times. You did not continue it. I say, yeah, but in 6 times I learned so much too. All those things I am doing at home. And I am also not doing, but I made Vilasarao to do it also. And he is also improved. He doesn't have to undergo surgery now. So I say, amazing, how did you pick up all this? I say, simple common sense. हे पाय असं सरळ करून ताट करायचं मसल्स. हे आता आम्हाला शिकवलं फक्त ते आत्मसात करून we try to implement it in the house and we see the benefits. Now Vilas Rao does not need a surgery. I don't need a surgery. I said, Baba, it's amazing how you overcome this. So then she brought her I think, elder cousin who's in 80s. Again, a smart, polished guy. He was working for World Bank. And he was given treatment by about 8 or 9 doctors across the globe. And mainly high potency drugs and high level insulins. And now he is, after retirement, like all Marathi Brahmin, he settled down in Pune. And from Pune he came here because Iravati insisted that you must see Dr. Boraskar. So he came and he was very well treated by some of the Swedish doctors and some of the Swiss doctors, some of British doctors, and I think there's nothing wrong with his treatment. I felt that everything pertaining to in their country, what is right, they have given him. Only thing, this man had a problem of pursuing that in Pune. So he asked me, what can be simply given to me? And how long you think I will live? So Iravati madam looked at me in a very interesting manner, like how a very senior school principal will look at the brightest student when he is trying to answer a question. That तो कौतुक मिश्रित भाव असा तिच्या चेहऱ्यावर होता, what I am answering this guy, because she probably felt that this man is little funny and त्याला मी उत्तर काय देतोय, so she was interestingly looking at me. So I told his name, I forget his surname, but I think he was Deshpande or something. Deshpande, yeah. But Deshpande said, now it all depends on what you want. What treatment do you want? I will give that treatment. Tejander, Mr. Deshpande looked at me, Mrs. Iravati Date also looked at me. And with my smile, I was trying to write a prescription for him. So Mr. Deshpande said, Dr. Boraskar, I feel you should have been in the World Bank. You have such diplomacy in your talking. Somehow you felt that I will not be happy with any treatment in Pune. So you asked me what treatment I should take. So Iravati madam said, don't you think that's a very right approach? Don't you think my doctor is giving you a right line of treatment? I said, I agree with you. So I only asked him, तुम्हाला काय पाहिजे? Now Iravati pushed it so much and said, you give him a simple medicine, and I gave one metformin and one downhill tablet, and within 3 months his sugars were absolutely normal. 80-year-old man does not need any high fancy drug. He was very happy that World Bank he retired with a pile, I'm sure. But pile, staying in Pune, he does not want to spend on medicine and doctors. He was wise. And he was very happy. Now every 3 months, he's a smart man. Of course, commuting from Pune to come here, he's on WhatsApp with me. Every 3 months he sends report on WhatsApp, endorsed by Iravati Date. Iravati Date madam is extremely savvy on WhatsApp and other things. And now she virtually works as my messenger for many complicated patients. And she drags them here like the big sister and gives them proper counseling and helps so many people. Well, all our responsibilities are over now. She said, my son is well settled, my daughter is married, my husband is also having his own life and he works with some Brahma Vidya and all that. And I got good time and you have given me good health, so I want to utilize it for good work. And she is a social figure. She is liked by everybody. She helps everybody. She gives scholarships to young people. She gets them here. And he said, तुमच्या ट्रस्टमध्ये बघा यांना काय मिळते का? कधी कधी माझ्या अशी फेकमफेक केलेली कधी कधी अंगाशी येते, but I managed to get it, By grace of God, I have enough connections. So this is a lady I will never forget. I have immense regards and respect for her. Not because she date, because my mother is date, not because she reminds me of my mom, because these are the types of people in our society which are the real backbone of our country, and they are the ones who are putting our society straight. We have to give them due importance, due attention to their health problems, look after them, and also ask them to come out to give priority to themselves and don't ignore themselves for the benefit and welfare of the family. They put aside everything and give importance to the rest of the family members and sacrifice. Such women are to be rewarded, adequately respected, and they will keep on giving you blessings, but they also know the value of your human being. You as a human being, they have terrific judge. They look simple, but they have a great judgment about people, and such people to have in your collection, it's a treat and pleasure. Thank you very much.